Think garlic is just a healthy addition to your diet? Think again. Learn the side effects of garlic you never knew it existed, from migraine to hormonal disarray. Number 1. Exacerbation of migraines. One of the most common ingredients in cuisines worldwide is garlic, which is believed to be healthy, but it can have negative consequences. A few people state that consuming garlic makes the symptoms of their migraines, a neurological disorder affecting over 10% of the population, worse. This could be because garlic aids the circulation of blood and contains a high content of sulfur. When garlic is crushed or chopped, sulfur compounds like allicin are released that may alter the blood vessel constriction dilation as well as neural transmission chances, which can lead to the onset of migraine in sensitive individuals. Indeed, although this is not a general phenomenon, patients with headache and migraine, regardless of nationality or geographical location, describe such reactions. People with migraines might need to be more cautious with garlic consumption. Despite understanding the cultural significance of many of these foods, patients should consult with healthcare professionals about this potential trigger. Number 2. Aggravation of IBS. Irritable bowel syndrome is a common condition that people worldwide struggle with, and garlic, an ingredient commonly used in culinary preparations, can present difficulties for sufferers. One of the important factors is the presence of large amounts of fructans, which are a type of non-digestible carbohydrates. Fructans are a group of sugars that can be poorly absorbed in the gastrointestinal tract and cause symptoms in IBS such as bloating, gas, stomach pain, and changes in bowel movement. This fermentation process known in other high fructan foods such as onions and wheat can worsen symptoms in individuals affected with IBS. As IBS is estimated to affect 10 to 15% of the global population, proper management of foods that may trigger IBS like garlic is essential for many people. In many areas where its usage is prevalent as a spice, the IBS sufferers may have to make adjustments and replace standard recipes with less uncomfortable dishes while still having flavorful food. Number 3. Hypoglycemia in diabetics. Despite the numerous potential benefits of incorporating garlic in the diet, consuming garlic can have negative effects for a person with diabetes, especially those on anti-diabetic drugs. Another benefit of garlic is that it can decrease the intensity of glucose in blood, which is ideal for diabetic patients. However, this effect can become unhealthy when coupled with other diabetes medications like insulin or oral hypoglycemic agents, since they can cause hypoglycemia, which is low levels of sugar in the blood. This is a risk every diabetic in the world should embrace because garlic is used in preparing foods in Asia, Mediterranean, Middle East, and Africa. This reaction, if not properly monitored, may lead to some symptoms such as dizziness, confusion, as well as loss of consciousness. As a result, diabetics need to be very selective about consuming garlic and seek advice from their physicians to ensure that the food they eat does not harm them in any way. Number 4. Potential impact on fertility. When one takes large quantities of garlic, which is widely recommended for its medical value, it has some negative impacts on the male reproductive organs, as may be deduced from some research. In earlier studies, it was revealed that garlic supplements may have an adverse effects on sperm count and motility, which is very vital in males. Thus, the effects are believed to be due to the hormonal and antioxidant effects of garlic and the disruption in hormonal balance in doses that may be sufficient for sperm toxicity. This is a relevant worry most often in regions where garlic forms a major part of the population's diet, including the Mediterranean, Asian, and Middle Eastern population. These results are not definitive and more studies are required. However, any man who is worried about his fertility may want to reduce his intake of garlic or seek advice from his doctor regarding his diet and its effects of fertility. Number 5. Interference with HIV medications. Garlic, of which people enjoy the health benefits, has a negative interaction with, among other drugs, antiretroviral drugs used in HIV treatment. Some investigations prove that garlic supplement may have an influence on protease inhibitors levels, which are considered to be the necessary medicine in case of HIV. This interaction takes place because garlic alters the enzymes in the liver to metabolize these drugs, hence making the concentration of the drugs in the blood to decrease, and in the process may water down the effectiveness of those medications. This is a major issue in areas of high HIV/AIDS prevalence like sub-Saharan Africa, where, for instance, ACS holistic remedies like garlic are a popular supplement to orthodox medicine. HIV patients should seek medical advice from their practitioner before starting to take garlic supplements in order not to interfere or jeopardize with their disease management and health-related results. Number 6. Aggravation of skin conditions. Now, garlic is a flavorful condiment which people use in many dishes due to its multiple therapeutic properties. However, it can cause certain issues for the persons with the delicate complexion or skin diseases such as atopic dermatitis and prurigo. Taking garlic in large quantity has been said to cause flare-ups and skin irritation in some people, probably because of its strong components like allicin. While these are healthy for the body in small concentrations, they can prove inflammatory to the skin and worsen the condition of individuals with skin problems. This is especially in relation to people in areas where the use of garlic as a seasoning is quite frequent, evidently from the Mediterranean and Asian as well as Latin America regions. The people who have sensitive skin type will need to regulate the garlic consumption since it precipitates their condition. It is advisable to seek a dermatologist's advice on what causes the individual to react and on how to design a healthy meal that will not have to be thrown out or replaced after a bout of skin rashes, which, despite it all, allows the palate to be excited by many different tastes. Number 7. Hormonal imbalances. In general, it has been also recommended that taking too much garlic may interfere with hormonal balance and thus, it may affect estrogen hormone in women. Precursors on lure plants are called phytochemicals since they work in a synergistic manner with natural chemical hormones in the body such as estrogen. Though these compounds are believed to be good in moderate amounts and better regulate hormones during menopause, the same could pose a problem to hormonal regulation in the body in high amounts. It could be problematic for women with various conditions affecting the estrogen level like endometriosis or some forms of breast, ovarian, and other hormone-dependent cancer. Due to the universal use of garlic in the diet of people all over the world both in Asian, Mediterranean, and other diets, its possible impact to hormonal levels should be clear. Some women may have concerns by using garlic due to hormonal imbalances, or if they are under hormone therapy, and thus they may cut down on the use of garlic and advise their doctors. Number 8. Adverse effects during pregnancy. Garlic is a popular spice, being well tolerated by pregnant women when eaten in normal food portions, but caution should be taken when one is taking much of it. Garlic contains compounds that produce platelet inhibition, and consequently, high garlic doses have been linked to the raised bleeding risk, making it dangerous during pregnancy, especially toward the final weeks of pregnancy. The anticoagulant characteristic of garlic can make it risky to take during labor or where surgery is in the offing such as C-section. Also, when taken in large amounts, garlic may lead to upset stomach which is prevalent during pregnancy and may lead to heartburn. These effects can be especially worth mentioning if the tradition of garlic consumption is rather frequent, for example, in Mediterranean, Middle Eastern, and Asian countries. Pregnant women should limit their garlic consumption and seek medical advice that will help in maintaining the proper intake of garlic in relation to the special circumstances they are facing. Number 9. Interference with thyroid function. Garlic has been claimed to interact with iodine, vitamins, and minerals. Thus, it may have a disturbing effect on thyroid health in large amounts. The Hay thyroid gland works by converting iodine to hormones that are responsible for metabolism. This means that if iodine is not available, then problems such as hypothyroidism can occur. Garlic contains nutrients that are good for the body, though the sulfur-containing compounds in it may compete with iodine, thereby reducing the available iodine in the body. This is especially useful in the regions, particularly in African and Southeast Asian nations where iodine deficiency is believed to be higher and where thyroid disorders are well known. However, for those who are in a predisposing state to thyroid dysfunction, it is prudent to moderate garlic intake and at the same time look at other iodine-competing foods. One should consult a healthcare provider for the management of the above-stated diets in order to achieve a normal thyroid function.